Small businesses continue to pay substantially more for their employees than larger businesses, typically 18%. And seniors continue to fall into the donut hole and not always be able to afford the prescription drugs covered under that should be covered under their Medicare Part D. As we try to reform some of these issues, I would like to see us try to adhere to some principles that I believe will be good for New Mexico and good for my constituents. We need stability. That means financial stability, but it also means if you lose your job, you should still have access to health care, and that you shouldn't get stuck in a job just because you're dependent on that health care. We need all Americans so that we can stop the cost shifting that currently keeps us from knowing where we can reap real savings in the system. If we are successful, America will be more competitive. Manufacturers will come here again instead of Canada because they know they'll have to even playing field. And small businesses will benefit. And seniors will be able to take their Medicare Part D drugs.
Take attention back to the question that you so conveniently sidestepped from the man in the balcony. How you're going to pay for this bill? You will be raising my taxes. The administration is getting ready to announce a $2 trillion higher national debt than originally anticipated. Like the young man said, our economy is in shambles. What fail-safes do you have in place if this public option does indeed put some of the private sector out of business and it has to absorb those people? How will we pay for this? That is why we are so upset. We are not upset because we don't want people to have health care. My heart goes out to those people. My mom had Guillain-Barré syndrome, and my dad had a Chiari malformation when I was growing up. My parents were very sick, but they had health insurance, thank God. My family, I am not against anyone having health insurance. I am against the government extending its tentacles into every aspect of our life.
Making sure that we continue to provide health care through the government to both of those beneficiaries, active duty and veterans, retirees who try care, and others through the VA. And we need to do a better job of making sure we explicitly fund the VA from year to year. I do not, the way that this legislation is paid for, and nothing's free. We can either go down the path of this legislation, HR 3200, which puts a surcharge on about a tax, yeah, absolutely, on 1.2% of the population, less than that in New Mexico.
Yeah, right.
Or we could do it other ways. We could put, the Senate seems to think the best idea is to put a tax on health care benefits. I don't think that's a good idea. Mr. Gessing may disagree with me, but I don't think it makes sense to tax health care to pay for health care. I'm open to other ways to pay for this thing. This is basically financed by about half savings and half surcharges, and between them, they cover the gap. Now, we can do this another way, but even if we don't do anything, these costs aren't going away. They threaten our economy every day. They're the reason why we're the only country in the world with 18% of our GDP going to health care. We can't afford that. We have to do something.
Remarks from our panelists would like to make before we close this afternoon's event. Mr. Gessing and then Dr. Richards.
We're going to spend more money this way if this is adopted. We need to spend less money and improve quality of health care. That can only be done by putting the incentives back in your hands and putting the decisions in your hands. The best way to do that is not public option or single payer. It's to give you the same tax benefits. I'm not talking about raising taxes on anyone. I'm the last person in the room who wants to do that. My idea is to give everyone the same tax benefits as their employers get so they can keep their health care when they lose their jobs or when they go without a job for a little while.
Dr. Richards?
guiding principles about what the nation is trying to achieve, we need to just revisit those for just a second. And the basic principles here are that our escalating cost of health care, that it must be addressed. We just simply can't afford the system that we are continuing to build right now. That one way or the other, we're going to have to pay for the uninsured to receive health care. And I practice medicine at the front door of the hospital, and I get to see the impact of the uninsured every day. And in fact, it's 50% of the patient population that we take care of. And I realize that cost of providing that care is passed on to all healthcare consumers, whether insured or not.
They still had to declare bankruptcy. That's money we will not see. And the 7 out of 10 cars sold on the cash for clunkers were tailor-made. I have a question. Excuse me, sir. I am giving him the background of why I'm asking this question. Show me the same courtesy I showed you. The simple fact is, this country is in an economic chaos. And I want to know, if you can't run the post office, if you can't run Medicare, you can't run Medicaid, the EPA is in a financial crisis, by the way. Fannie Mae and Freddie Mac are a disaster. And you're expecting us to give you our money for running socialized health care? No, sir.
Pipeline issue. Congress can help with that, and there are incentives in this bill to create more primary care doctors and more generalists, but we're also going to need the help of our institutions that teach medicine, the accrediting agencies that deal with that. We need to produce not only more docs and more health care providers, nurses, nurse practitioners, you name it, physical therapists and others, but we're also going to need to, in addition to covering the uninsured, get in front of this baby boom wave that we've seen coming for a long time, and that we have not adequately addressed in our education policy and with our pipeline issues.
Thank you,
It's not a perfect system we have. You know, this really did develop post-World War II as a way to attach people's health care as a benefit to their employment. That's not ideal. That makes it very difficult for us to compete around the world when other places don't organize it that way. But that is our history, and we have to work to some degree within the existing system. It is, if you don't think we should throw the whole thing out here, create a single payer, it's just as chaotic to say the federal government is going to completely abdicate it.
But are people who disagree with the public option going to win, or are we going to be able to get true healthcare reform that will make people like RJ, my kid with leukemia, get the kind of care he needs?
Thank you, Dr.
I just want to reiterate not only my commitment to the public option, but my commitment to, if we don't begin to pull all Americans into this pool, we will not have succeeded. And if we don't get everything in a bill that's necessary to fix the healthcare system, we're not going to quit working on healthcare. This is, we can't have another 20 years where no changes get made that help the system and that help people like the child you just described. So we will get everything we can to improve healthcare in New Mexico, across the country, but we're not going to quit just because the president signs a bill.
The most important thing. Medicare gets paid as you go along, and you can certainly say that's a subsidy because we have to shore up the Medicare system. But when you look at the public option, all we're talking about is an administrative pool that is paid for by the premiums of the people who participate into it. They're going to have to pay for that.